Where do you see the future going with these sorts of things, Howard? In terms of, do you think there'll be, does the future hold in terms of, less bearing surfaces and different, like say even better? I know there's newer grades of polyethylene now. You mentioned the vitamin E infused polyethylene, but do you think other materials will come in terms of, going from metal towards ceramics or even pyrocarbons, or is there a direction that things are heading in with regards to that?
The direction is yeah, they're looking at the bearing surface at the moment is highly cross-linked polyethylene with vitamin E to reduce the free radicals that degenerate the polyethylene. Some have looked at ceramic, but I think they've looked at it from the allergy point of view, because a number of patients have been found to be nickel allergic.
Okay.
I have no experience of use of the ceramic or the oxinium, which is one of the companies uses a layer of ceramic. I think the direction that it will take, it's going to be based on either using 3D planning and 3D printer for individual implants, but still using the same type of metal implants with a polyethylene liner. And I suppose what we would be aiming for is to try and delay the need for a knee replacements as the end stage of treatment of knee arthritis. So maintaining the joint as long as possible, supporting the tissues, looking outside the knee and the hip to try and actually improve the individual, and looking at lifestyle. It's incredible that it's probably been around for so long, but in the last 10 years, people are really looking at lifestyle, looking at, I think somebody called it dietary inflammatory load.
Right.
Don't worry, I don't understand that either. But they're looking at the dietary index to see if the constitution of an individual's diet predisposes them to osteoarthritis. Because at medical school, what we learned about was mainly injury and patients with cartilage problems. But looking at lifestyle, looking at diet is becoming such a big thing now.
Yeah, big hot topic. And I mean, one of the things I think read relatively recent in the last few years is there's a fascinating piece of research that showed it was something like, even just in simple terms, things like, just looking at your BMI, your body mass index, and if people lost something like 10% of their body weight, it often then led to a 50% reduction in their knee pain.
Yeah,
that might be exact figures, but it was something like that, and as you say, just how big a factor the biomechanics, their overactivity and lifestyle can be. So yeah.
And I've had an interesting, Rob, sorry to interrupt, I've had anecdotes when the lockdown was eased and coronavirus, and we had telephone consultations, and you'd ask patients, well, how have you been during the lockdown, and how's your knee? And some would say, oh, you won't believe it, doctor. I've been doing exercises, I've been following XYZ on YouTube, and I've lost weight. And I feel that my knee's better. So I don't want anything. Thank you very much. Goodbye. On the other hand, of course, I've had I think, is it a couch to 5K run?
Yeah.
It's usually men, unfortunately. We men, so we get off the couch and start exercising. But those are usually, meniscal injuries.
Yeah. We've seen a few lockdown injuries as well from, but no, you say there's pros and cons, isn't there? So, but no, that's interesting. Very, very interesting.